Thank you so much, Shannon, and thank you everyone who's joining today. We have just over 100 participants at the start, and I'm really grateful that you all are taking the time to join me today. I know you have a lot probably going on in your own lives, and during this time, I'm just really appreciative that we can learn together around this topic that is incredibly important, particularly now during our current landscape where we're using so much telehealth in our practice. For those of you who are first attending this week, this is the second presentation of a two-part series. 2 weeks ago, we talked about understanding how to leverage telehealth technology for prevention services. And in that one, we really spoke about which technology software you should be considering based on the features that it provides and how you might use telehealth technology in general to help with prevention efforts. Part of that was looking at how secure and private certain software was, and we're going to spend a lot of time talking about that today. So our topic on legal and ethical considerations, it should be robust. I hope I leave you all with a little bit more information to think about during your practice, especially because this is probably new for many of you. And then I really encourage you all to ask some questions at the end so that we can help problem solve or understand maybe your own situations and how we can make this relevant if it's not already. So as I mentioned last week, and I would feel really remiss if I didn't do the same thing here, it was just recognizing the amazing work that my team at the University of Utah does in schools. We do a variety of different services around supporting behavior and mental health through multi-tiered preventative services as well as treatment services, a lot of teleconsultation and training and professional development. So for us, fortunately, during this time, we've been able to make this transition a little bit easier. But I wanted to give a shout out to my team and the school districts that we partner with. If you're interested in learning a little bit more about what we do, please feel free to take out your cell phone right now and you can scan that QR code with the camera that's on your phone. And if you want to check it out later, I'll have some more links for you to follow then. As we move forward today, and really kind of the scope of everything we're really talking about, if we think about last time, is telehealth safe and secure? We kind of had this list that we spoke about in the first session. That's why I wanted to bring it up again today. What should we be considering? And we kind of talked about last time that it should be, is this evidence-based practice for the work we're doing? Can you bill for these services? Is it safe and secure? What software do we use? How do I engage with clients and stakeholders? Today, the real focus is going to be on safety and security and practicing ethically. And so when we think about practicing ethically, for me, it's about quality of the work we're doing while maintaining these issues of confidentiality. And so, of course, the first thing that comes to mind is HIPAA and FERPA. And for many of you, this has probably been a driving force of how you maintain your client records and make sure you're doing work in a way that helps them feel secure and know that the information they share and everything that you keep is safe. That being said, when we think about HIPAA and FERPA, they're similar, but they're a little bit different. So let me walk you through both for those who maybe aren't as familiar. And there's always more information that you could probably learn, but this is sort of the quick summative kind of impression that I have. HIPAA is largely talking about medical, personal health information. If you're going to your psychologist, if you're going to your primary care provider, any of those are going to be protected by HIPAA. That's going to be largely the medical kind of conceptualization and clinical conceptualization. Then you have FERPA, and FERPA is going to be our Family Education Rights and Privacy Act. And this is something that the federal government instated to protect the records and privacy of our students and giving rights to families about how they can access those records, what kind of processes they have to go through. They're very similar in the sense that they're about protecting client confidentiality or student confidentiality. And so when we think about telehealth and about prevention services and we think about the work we're doing, first and foremost, we have to make sure our software is HIPAA and FERPA compliant. And we have to make sure that our telehealth work meets these standards. For me, that is the primary decision maker. And so if we piggyback off of the conversation last week, how are we picking our software? This is a really, really important decision-making factor. Now, if you're doing this work, you're probably wanting to practice in a pretty ethical way. Part of being ethical through telehealth is practicing within a professional competency. And I spent a lot of time thinking of this, particularly in light of our current COVID-19 pandemic and the move to more telehealth-based services. And I realized that not only were we trying to raise our kids, if we have kids at home, educate them, keep our well-being and everything in place, and also serve our clients, but now we have to think about doing this in a ethical telehealth way. And so it would be kind of naive, I guess, to think that people actually had this competency coming into it. And I say that I imagine that some people did, and probably many folks who are joining today for this webinar, maybe you've had some experience. I imagine it varies greatly. And then my concern was, wow, how are we actually going to be able to deliver these services in this professionally competent way? Well, the good news is, and if any of you are following folks on social media, or you follow the membership organizations you're part of, there's been a ton of great resources coming out to help people feel more competent to get more training, and also to have them feel more confident about the work they're doing in an evidence-based best practice kind of standpoint. So that being said, we all need to learn more. We all need to use this time to continue to refine our ability to practice. And I think that is part of our ethical legal considerations. If we're not practicing competently, that's a barrier based on our ethical codes across the board, whatever it is that we adhere to. So for me, training and professional development is critical. And so through today's presentation, what I really want to hit the high notes on are these areas that I've listed on this slide. First and foremost is security. And we're going to talk a little bit about what makes your telehealth experience secure. We're also going to talk about privacy. What are the nuances? What are the things you actually have to overtly do to create privacy and to create comfort in that space? Because I think for me, privacy isn't just, here's this room that doesn't have sound that other people can hear, but it's also some of the environmental things that occur that make someone feel comfortable to feel that this is private. We'll talk about that. We'll then speak about the physical environment, the space that people are in particularly, and what are some of the clothing you can wear, the background, lighting, things that are really important. We'll get to that. And then we'll jump in and spend some time talking about Rapport and Therapeutic Alliance and how you can actually do this through telehealth. It's hard. And we'll spend some time talking about what you can do to at least make it a little bit easier. Then we'll switch gears, talk about state and organizational laws and guidelines. These are really important, largely because even within our PTTC region here in the Mountain Plains, we have a lot of variability. And so I think it's important to know where to turn for those things and how to help make decisions if you're trying to practice now or in the future through telehealth. We'll spend a little bit of time talking about consent for telehealth, and I'll show an example of some of the consent forms that we use for our projects. And then we'll end with some practical considerations and open it up for questions so that you all can hopefully feel more empowered as you move forward. Okay, so first and foremost, what makes telehealth secure? We've seen a lot recently about what makes telehealth not secure. I know of recently, we've heard a lot about Zoom as one example of a provider who had a lot of bad PR because there was issues of security. And I think since then, Zoom has come out with a lot of updates and have made attempts to make sure that it meets all the standards. Independent of one software and maybe the issues that are occurring, what's really important to consider is that you have this HIPAA Business Associate Agreement, or the BAA. If many of you have maybe jumped on other ethics trainings or have learned a little bit about telehealth during this time, I'm sure this has come up. This is a super important piece. It's probably the most important piece if we're practicing through telehealth, because really what it's saying is that you as your entity and the people you serve, the data that you hold, you are signing an agreement with whatever company is providing your services that they will take all the HIPAA compliant precautions to ensure that your data is encrypted and stored and unable to be disseminated in any capacity by people who probably are largely trying to access this information. And that's the scary thing I think about online practice, is that you become more susceptible to folks who are trying to obtain your data. it leaves a lot of accessibility just because it's a dynamic system that's always changing, and people are trying to figure out new ways to access this. So the best procedural safeguard you could have by providing telehealth is to make sure you have this agreement in place, signed by both entities. And it's a safeguard for you to make sure that your data won't be distributed or accessed inappropriately. We also have to think, after we have this agreement, what are we doing around different components of our practice? So for me, I'm always thinking, where am I storing the data? For a lot of the telehealth work that we do, we're providing a ton of supervision. And I'll spend a little bit of time talking about supervision towards the end of this presentation. But when we're providing this, we need to have a permanent product of the session, because as graduate trainees, we as supervisors, myself and others on my team, we go in and we have to look at that data. We have to tell them things that they're doing well, things that they might need to do differently. So storage of data can be really important from that sense, but also you may have records, you may have case notes, you should have all these things. And so you're probably storing them online. I imagine many of us have moved to a more online format. So thinking about storage of data, what's going to be really important is that you either have a very robust cloud storage system that is also HIPAA compliant that you've signed this agreement with, or you may have a standalone software, like many of the medical centers, at least here in Utah, at the University of Utah, they use one called Epic. And I think that's somewhat popular across the country. One that we use in our lab is called Titanium. And these are different softwares that we can use that are HIPAA and FERPA compliant that allow us to store data, to have our plans in there, to have communication between therapists. So we find that that's really important. And I'd encourage you all to have really good safety around the data and how you're storing it. Disposal of data. The great thing about keeping things digitally is you're able to compress what would be stacks of paper, and if folks remember working in that format, I know I do, and thinking about how are we gonna make it more compressed? Well, the online format does that. It creates easier space, so we don't necessarily need to dispose of the data as frequently, but there may be some laws and parameters, like you must retain your data for 7 years before destroying it. And if you're doing that, just thinking about where are all the places my data lives. You may have people who keep data in other places. And so having a really strong data IT infrastructure, someone who's giving parameters about, no, you can't have it, it must live always on the cloud. And when we're done, you need to put a request into some person who manages that. There just has to be systems in place. And I think when we're going to telehealth, unfortunately, with what happened recently with COVID-19, we had to make this switch literally overnight. And that's not how things should tend to go if we're taking that more preventative, more piecewise, systematic way about going. That being said, I think people did a pretty good job, but I'm sure at this point we're going to have to be filling in the holes, or kind of retroactively looking backwards about how can we strengthen and improve these infrastructures. We've seen around security, the Health and Human Services Agency has said, we understand that during this time, it's going to be really hard. We want you to continue to try to meet all of these standards, but in the event that something wasn't possible or there was an error, we are not interested in following through with prosecution of those HIPAA breaches. And so that's how I'm interpreting the most recent guidance that came out. And of course, these things could change at any point when the federal government decides to change these or update these accordingly. Something that's really important for security is also being able to verify the identity of the clients you're serving. For us, a lot of times we're doing a lot of telehealth with students in their homes now. Some of them don't want to be on camera. They just feel less comfortable. There's always issues of engagement, of course, if their cameras are off. In the same way, if we're at like a business meeting and we had our cameras off, there could be some thought that, is everyone paying attention? What's going on? So what we ask them to do is, hey, just turn your camera on for a second, verify you're there, say hi. And we like that because we want to make sure that in the event that it wasn't them, and let's say it was a parent, and let's say they were talking to us about something that was really confidential, and they didn't want their parents to know, we don't want to get the false sense that it's a secure environment that's private. And we'll talk a little bit more about that in a little bit. So verifying identity is really important. Also, you want to make sure you have contact information for the people you work with, best phone number to reach them, and their address, their permanent address. Because as you can imagine, through telehealth, we are limited in our ability to do crisis response. If someone's in our office and they disclose that they're having suicidal ideation, and then we do our suicide risk assessment, we find, well, this is actually a pretty pretty high risk, and we want to make sure that this individual doesn't leave our office. Well, we're in a predicament here for doing this through telehealth. And so, as you can imagine, when it comes to a population of substance use prevention, we have to be keenly aware of our ability to access these individuals and have a crisis plan in place in the event that something does happen, so that we can rapidly respond and we're not retroactively saying, oh gosh, what do we do now? I have no plan in place. That would be the worst thing to happen. So when you're doing telehealth, I would always recommend you have maybe a generic crisis plan that is templated and outlined for your agency, and then you can customize as needed based on modality or contact person. Again, a lot of this is prep. And so if you're sitting here going, oh my gosh, I don't have these things in place right now, that's okay. I think we need to reflect and be formative and say, what can we do to improve this? And we talked a little bit about recording already, but making sure that when you're recording it, that you're doing it in a really safe, secure way. Are you updating it directly to a software for supervision? So for us, we use a software called Listen, Lyssn. This is like an integrated video recording and supervision tool where you can tag and put stuff. And then it's really cool. They do some machine learning for motivational interviewing. So they'll tell you, if you're doing motivational interviewing, how effective your MI was. There's some really cool stuff I think you can do with recording, making sure it meets all of those other requirements. Okay, what makes telehealth private? For me, it's largely the environment, and we'll get to that in our next content. But also thinking about the physical space, location. So for example, if you were in Starbucks, which we can't do right now, but if you were there and you wanted to have your telehealth session, that would be a very poor choice of location. It would not be private. If, on the other hand, you were in a space similar to how I am right now, I'm in a room in my home and I have my virtual background on, this would be a private space, or at least it gives the same impression to the person who's in the room with you of that. Location is really critical. You can also have things like, are you outside or inside? And I think just there's not a great deal of research to say, like, if you have a session outside versus a room, what does that look like? And so I just think being conscientious of who's around you, the people who are around you, who may inadvertently come in, maybe having a sign on your door if you're at home. I know I have 2 small children at home, so I'm always preemptively talking to my partner and my children and saying, here's the parameters for next hour. Please don't come in right now because I'm going to be on a webinar. I mean, it would be cute to see them, but I think you all want to learn about telehealth rather than hang out with my kids. So those kind of things are really important to just lay the foundation for on the front end. And then sharing content. If you are screen sharing, if you are talking to different people, you need to make sure that these things are outlined on the front end, particularly for parents, because I think a lot of times with our students or children currently in the home and their parents being in the home, if some of the conflict or some of the impetus for their substance use or their risk for substance use is coming from relationships with their parents, we have to be really aware of what is our kind of threshold of privacy and what can we disclose to the parents appropriately and what could maybe impact the therapeutic relationship. Okay. The next thing I'm going to talk about is the physical environment. Like I mentioned on the previous slide, to me, this is such an important piece because I'm a strong believer that the way we arrange our environment can be largely impactful to things like rapport and other success within session. And that includes the same for telehealth. And so when you're thinking about how am I arranging my environment, I want you to think about how would you arrange your environment in person? Start there. Do the exact same thing you would at least do in person, and then think about what you need to do to enhance this experience. Because our environment can be a great tool for engagement. And this will be kind of a thread that comes through the rest of my presentation. One of the biggest issues you're going to have ethically practicing through telehealth is how are you engaging your client? Now, many of you probably have the same issue in person. How am I engaging my client? So I want you to see the parallels, that if you're scratching your head saying, this is hard, remember, this was hard in person too. We just have to work a little bit harder now to learn the strategies so that it can be effective. Because I have seen with our own work and others, and if you look at the literature, there are successful strategies. We just need to get them disseminated and people more proficient. Remember, everyone just started using video conferencing, whereas 2 months ago, there was a much smaller proportion of people who had. Okay, so physical environment. First and foremost is clothing. The recommendation around clothing is that you wear solid clothing without a lot of patterns. So I try to heed this advice. I guess I'm just a little bit more informally, but I have a lot of solid t-shirts, and the weather here in Utah is extremely warm today. It's almost 80 degrees. So this is a really effective color. The reason why you want to make sure your color is solid and not patterned is because the more patterns, the more activity that's going on within your clothing, it eats up more of the bandwidth. And bandwidth, we'll talk a little bit more about this as we go through, is really just the rate at which the information is being transmitted through the internet back and forth. So we want to try to minimize those things, because you all have had this experience, and hopefully it hasn't today, where someone maybe breaks up for a second, or they freeze and they're stuck in like the most unflattering face for a very long time, and you're just like hoping that everything's okay. You want to reduce those issues by having solid clothing. You also want to have a solid background environment. For me, I really enjoyed the virtual background that Zoom provides. This is the software that we use. And so it's nice because I'm in a room right now that I think is still professional. I have pictures of my children behind me, behind the virtual background. But for me, when I do these webinars and when I work in professional spaces and with my clients, I really want to create an environment, a background environment that would be consistent with what the listeners who I'm speaking to would expect in an in-person. So for me, if I was here, I think this would be more professional. Whereas if I'm in a session with a client, I might change my background so that it's more looking like a therapy office. Like maybe I go online and Google images for a traditional therapy office, and you maybe have a couch in the background, you have like your little plant over there. You could virtually put that in your background. So play around with that. I think that helps for the physical environment. It's a great way to engage your clients too, to get them to pick their backgrounds and create a space that they feel comfortable with too on their end. Because remember, it works both ways. You have to make sure you set your environment. We can be more flexible with what they have, especially under the conditions now where everyone's sort of stuck together and just doing the best that they can. We also talked about people a little bit before, and I'm going to hit on this one again. We have to just be conscientious of people who are around us. It's probably one of the most important things, just to be aware of your surroundings and who may overhear what you're saying, who you're speaking about in session. And so just making sure you're in no public space. If you're going to be outside, like maybe you're in a comfortable place in your backyard, which I've seen people do. But again, like how close to your neighbors and to what extent do you have headphones on? Those things are going to be really important. Lighting. We talked about location, so I'll kind of breeze over that. But lighting is such an important piece as well. There's some great videos you can watch about like how to create good lighting at home. We all have to sort of be like YouTube stars now and have like all the infrastructure set up. And I say that tongue in cheek. I don't think we really have to do that much, but really thinking about good overhead light, good front facing light. Right now in the room that I'm in, I have two windows, one behind me to my right, one over here to the left. Both blinds are up really high, so we get like nice light coming in. And I have an overhead light. You can always buy external light kits if you really want to get fancy with it, but just great overhead light is awesome. What you don't want to do is have a really strong backlight where it's that ominous person sitting there and it's kind of scary. And you're like, I'm supposed to feel vulnerable and comfortable in this session talking about stuff, but I can't see your face. And I think it's you. So we want to try to reduce any of those barriers by really providing great front facing light that that really shows you. I mean, it's about having this face-to-face interaction. Camera position. This is one that I'm sure you all can experience. There's many ways that I could orient my camera right now. I have a standing desk, so my camera is essentially right on with my face, maybe a little bit lower. But we've all seen those people who, maybe they're, let me just check my camera so I can give you the full effect. There's the people who do the underneath view. There's like different angles that maybe aren't as flattering. And so I just think about your camera angle. Think about the position that it's in. You should feel okay with how you're presenting. And if you don't want to look at yourself, if it's distracting, most of the softwares, without turning off your camera, you can hide your view. And then that's nice because then you don't have to keep looking at yourself if that's a piece of discomfort. What the research talks about as far as camera position also talks about eye contact. And this part is so interesting to me because the research, there's someone who studied this, and I think it's fascinating. We all have our cameras right now in front of us, and it's probably an external webcam or built into our laptop. If I want to make eye contact with you, I have to stare right at that camera. And that's what I'm doing right now. But if I'm video conferencing, I am not looking at you. So there's really this difficult ability to make true eye contact. The remedy for this, through the research, is if you can go about 5 to 7 degrees from the camera. No, I'm not taking out my protractor to make sure my eyesight is that, but generally I say between the person's head and the camera, you're still gonna simulate decent eye contact. And this is nice because then you can move your gaze to get better context of their facial expressions and gestures, which are even more important during this virtual format. And so for many of you, you're realizing that I'm trying to talk with my hands a lot, I move around. I really wanna make this experience better, or as best as it could be, despite us being virtual. And I think you have to do the same thing in therapy to be able to get that level of robust quality. Sound and audio quality. This is another really big one. With sound and audio, we've all had the problems. It's good to test these things. It's good to make sure that they work. It's good to be able to know yourself how to problem solve these things so that you can have high quality sound. I'd always say use headphones to the extent possible. That's going to be huge. Making sure headphones are charged if they're wireless, because you don't want them to stop working halfway through. And then also just looking at interactions in general. And we'll kind of talk more about this, but this is a face-to-face interactions as much as it is in person. And we have to take these overt attempts to create better interactions through some of the multimedia functions we have, through polls, through whiteboards, through chat box, through, you know, having your client do funny things. Hey, go show me one of your pets, or I'd really like for you to show me something, take the computer or tablet or phone or whatever they're using, and I want you to show me something really cool in your house, or take me somewhere to see that, if that's available. Now remember, all of these telehealth services could be more difficult to come by if the clients we're working with don't have access to technology or internet, which many of the individuals we work with, many of the adolescents we work with and children we work with who are at risk for substance use, many of them maybe aren't engaging or aren't able to connect. And so I think we do also need to think about that as well. Okay, with the next piece that I think is really critical is Rapport and Therapeutic Alliance. And so for this one, I have a link on the slides. Feel free to check it out. This is on ResearchGate. They published like a preprint of the authors who I listed up here. And this was just around COVID-19 tips for building rapport with youth via telehealth. And it's just a really practical tool. I've really enjoyed using it and sharing it with my students. There are things that we've found as well, but there's just some really great tidbits that I think that they have their finger on the pulse about how to get creative to do some of this. And they're talking about things like setting up the environment. So kind of, we talked about those things before. What are all the parameters we need to do? Introducing telehealth. This is a really important one. It might be that the individuals we're working with maybe have more proficiency than us. They're more competent with telehealth. So maybe just talking about our own limitations or where we're at, and maybe empowering our clients by saying, hey, you can teach me, this is a bi-directional relationship. We can support each other. I think it's always appropriate to be vulnerable in that sense, especially around technology. It can be really hard for people. And then they spent a lot of time talking about building rapport. And I want you to think about how you would build rapport with someone if you were there with them in person. You would ask them questions. You would probably try to empathize with them. You would try to seek to understand their circumstances. You're going to ask them about things they like. You might actually want them to show you things they like. Hey, do you have this YouTube video? And the cool thing is we can do all of that through this format. We maybe even be able to do it maybe more seamlessly. We can share our screen. We can have our whiteboard. We can play games. We can have them share a screen of their favorite game or favorite YouTube videos that they're watching right now. We can maybe even play games simultaneously with them by logging into maybe an online platform or something like that. So I think there's a lot we can do through this virtual format, knowing particularly that the children and adolescents who we're working with around prevention for substance use, many of them are really tech competent and are interested in this stuff. I also think it's about like having fun and realizing that when it comes to working through telehealth, that's a whole new group of expectations and parameters that our children and students that we're working with are learning as well. So it's going to take some time. I know when I first started going to therapy myself, many years ago, it was like, what are the parameters of therapy? How are you supposed to act in therapy as a client? Then as a therapist, what are the parameters? And I think that those parameters can be different on telehealth or feel different than if it was in person. So talking about those things, and spending time to really understand what may be hard for them. And then of course the engagement piece. If you're not following some of the teachers who are on social media who are really utilizing great online pedagogy tools, learning management systems, Kahoot, Flipgrid, Nearpod, there's so much cool teaching tools that we all have to learn. And so I think this is an area where education has taken the lead, and we can look to them and say, how can we take instruction and educational technology and infuse them into our prevention efforts to create better engagement? Is that, hey, I want you to, in between sessions, upload a 15-second video of you talking about something that was hard today. There's some really cool things that we can do to build therapeutic alliance that don't have to necessarily occur in this maybe traditional conceptualization of telehealth where it's video conferencing. Remember, telehealth is broad umbrella that includes everything from email, text messages, social media use, and the kind of bubble gets bigger and bigger as we think about the applications of e-health and telehealth. Okay, I want to spend a little bit of time talking about consent for telehealth because this is really important. You probably already have consent in place for the services you're providing. That's standard. But what's different about telehealth is that you also need additional consent for the telehealth services. The reason you need that is because this is a different modality that people are not used to. And even if you integrated it within your main document, you really need to have an explicit place where people can sign to know that services are through telehealth and that they understand and recognize barriers and positive implications of using it. As things progress through time and more people become familiar with telehealth in practice and it's more standardized after COVID-19, I think that we'll see more integration of telehealth as just like a standard practice. Like check the box if telehealth is an option you prefer, but we're not at that place right now. We need this explicit form. This next information I'm going to show, and I'll kind of talk over it, is the information that we share through our lab as like sort of a template. So this will kind of breeze through the document, and I'll narrate a little bit as we go. But really, it's really about accessing telehealth. This is like the instructional piece that we give them because we assume that the individuals we're working with don't know anything about this. So it's a step-by-step guide. Here's how you log on to Zoom. Here's how you log in. Here's the email you should set up. And it's really, really step-by-step because we found that can be such an important piece. Let me skip forward here so you can see this part too. So we also include the Suicide Prevention Lifeline, Crisis Line, and the Therapeutie app because crisis could happen. This is our prevention plan. Here are the pieces you can go to when you need them. And then finally, we get to our kind of stock telehealth consent form that goes through all the things that we've been talking about today and really lays it out for individuals so that they know things they should be worried about and what to expect. We sign that, and then we put that in with the rest of the information and consent forms that we have for services. Okay, I'm going to switch gears, talk a little bit about practical considerations. We're getting closer to the end, so if you're thinking of questions, you can start jotting them down. But I hope this has been helpful up to this point. So with practical considerations, again, we talked about the 5 to 7 degrees and simulate that eye contact. There's the study if you want to geek out on it like I do. Limitations of video conferencing should be explicitly discussed with clients prior to treatment. It's such an important piece. Everyone's forced into this. It doesn't mean we're not largely uncomfortable still by it. What we do know is that acceptability of technology for consultation or telehealth increases with exposure. This was a study that I did. This is actually my dissertation many years ago, where we had teachers who experienced video conferencing to meet around student problems. We asked them to rate their acceptability on the front end, and then after they experienced the video conferencing and their acceptability went up. So there is this exposure piece. We have to get people used to it. Flooding is never really the right idea, I think. So this was unfortunately what we had to do, but maybe shaping up some of the competency and acceptability will be really important as we continue to train folks and do this work moving forward. We also want to ensure sufficient internet connectivity, both locations. Sometimes this can be easier said than done. And if we don't have that, you can do really simple things like turn off your video to increase bandwidth so it's just audio. You may consider backup plans for technology. Hey, if it's not working, we're going to go straight to the phone. We're just going to have a phone session, which is also an acceptable way about going to do these things. And then I also included this link. I thought it was really relevant, and I wanted to share APA, the American Psychological Association, which is really the one that guides most of the work that I'm doing. It has a great accessible tool around practice guidelines for telepsychology, which are very comparable to other human service fields. And I really encourage you to check it out just to get a kind of a quick applied way of thinking about sort of all the elements that we talked about today. Okay, I'm going to talk a little bit about state and organizational laws and guidelines. We'll talk a little bit about supervision, and then we'll be wrapping it up in the next 5 to 10 minutes or so and have a chance for your questions. As you can imagine, the state and organizational laws and guidelines are varying state by state. We want to have some consistency, and I hope this maybe has people realize that we need to have maybe some federal consistency around some of these things. We're starting to see some of that happen with Medicaid, so maybe this is really, there are some silver linings, I think, through this that we can consider. But when it comes to the telehealth across the US, let me show you a little bit about some of these guidelines. So again, APA has a great resource online, the link's there on the bottom. But it really takes you through a glossary of the terms, talks about everything from reimbursement, licensure waivers, things like that. Let's skip down so you don't have to watch all of those. And then we'll go straight to Utah as an example. And again, you can look at your relevant state, but it goes through and talks about all the existing coverage mandates, emergency state actions, telehealth reimbursement, and just any changes, emergency waivers, things like that. So I really like the accessibility of this tool. And like I said, the link's right there. You can pop your state in and have a little bit more information. Okay. The next one, and I'm really excited about this. This has been in the works for many years, and as a telehealth researcher doing this for 8 years now, I was really excited when this first came out. This is called the PSI-PACT, and so PSI-PACT is this kind of entity that's created across states. It's through legislation that lets you practice across state lines for time-limited services, 30 days or less, particularly for transition of services or emergency type services. And all the states that are in blue, as I start this little video here, are going to be the states that have it enacted. You can kind of see the rubric as we go down here. And then there's states that are in that kind of lighter blue, states with enacted but not effective, that there are none right there, and then the states with pending PSI-PACT legislation. So these are ones that are coming up. And so the really cool thing, I think, about this legislation was that it needed 7 states to get enacted. These are all the states that are pending, so there's a ton that have, and then these are the ones that have it enacted. Being in Utah, I was really excited to see some of that early enactment going on. And so this important note here just to pay attention to, once 7 states had officially enacted PSI-PACT legislation, it kind of went into effect. Next, they are working on establishing their kind of bylaws and rules. And then once those are finalized, the application process will open for practice jurisdiction. So we can actually do those things, which I'm very excited about. I think that's a really great first step for telehealth to come to the mainstream, and who knows where else this will go. So there's the link if you're interested. They have a listserv. I follow it just because, again, like I like to geek out on all the new updates for telehealth. But if this is pertinent to you, I'd recommend you follow it as well. All right. I would be very, very, very remiss if I didn't spend a little bit of time talking about telesupervision. This is a text that my colleagues and I edited in 2019 around technology applications in school consultation, supervision, and school psychology training. This, of course, is for school psychology, but a lot of the work we're doing is working with adolescents and children and a lot of prevention efforts. So I think this would still be really applicable. But when we think about supervision, this is probably a role that many of you are doing in various capacities. So again, thinking about recording and sharing and what software you're using and how are you being secure and private in your supervision, because I think there's an extra layer with just you knowing the inner workings of what's going on. How are you providing digital feedback in a secure, safe way? Because now we also want to make sure that the person who's receiving your feedback, there's no breach of the information. We go back to our electronic records, what systems are we using? And then really supporting telehealth training. Like the webinar we're on right now, this is hopefully a good sort of primer on this, but I would encourage everyone to continue to learn. And this stuff's changing constantly. And as a supervisor, if you're providing telesupervision, you have to be competent, but you also want to make sure you're teaching your supervisee to be competent. I know I've had all of my graduate students who are on their pre-doctoral internships this year reach out, and they're all practicing still. They're at places across the country like Boys Town and Nationwide Children's Hospital, and they're having to do telehealth, and they all report back saying, we're really grateful that we had some of this training and supervision because it's really helped us feel more competent during these times. So please consider your own competency as supervisors. Okay, let's do a slide just to wrap this all up and summarize. We have to make sure we're practicing competently. There's a lot of work to do that when we're going through telehealth. We have to consider things like privacy and security. We need to get explicit consent from our constituents. We need to be working constantly on outreach, particularly during this time, and focus on ongoing training. Like I said, this stuff will change. Hopefully I'll be up here again to present to you maybe in the next year or two, and we have great new updates, but stay vigilant about learning about these things. With that, I want to thank you all for spending some time learning about these things with me today. Again, check out our text if you're interested in learning about this. I know that the publishers are putting the first chapter online for free next week as a way to help folks. It's on teleconsultation, so check that out online. You can also see our website to see if there's any work that we're doing that maybe appeals to you. Follow us on Twitter if you want to see all the updates and resources we have. And at this point, I just want to turn it over to Shannon and say thanks again for your time.